بلادي
وانت تحكي من هنا.
طب بلادي اختي وهي قاعدة لسه ما سكرت الباب الهاون وقع بنص بيتها بيتها فيه هلا بده $200.
In a region scarred by conflict, battered by disasters, and locked into systems that perpetuate poverty and injustice, children face staggering challenges. Challenges that force some to grow up too quickly and others that don't allow them to grow up at all. But it is also a region of tremendous opportunity. In recent years, we have seen significant strides in the access to and quality of healthcare and education, which have led to substantial changes. The changes we've seen give us hope that much more can be done. That's why, as World Vision, we have set ourselves the goal of enabling 10 million children across the Middle East, Balkans, Caucasus, and Central Asia each year to experience life in all its fullness. This is a big goal. It requires a relentless focus on the most innovative, effective, and efficient programs to achieve it. We constantly review our work and adjust our approaches to achieve the greatest sustainable change possible. The goal is so ambitious, we can't achieve it alone. Children, youth, communities, governments, organizations, and people of faith are critical partners in bringing about significant and sustained positive changes to child well-being. Across this region, World Vision strives to ensure all children experience good health, are educated for life, are cared for, protected and participating, and experience the love of God and their neighbors. In Afghanistan, a country with one of the highest infant and maternal mortality rates in the world, we have seen significant changes. Thanks to World Vision's midwifery program, through which more than 350 midwives have been trained, we have seen a 37% increase in the number of babies delivered by skilled birth attendants. Healthier babies and living mothers mean a stronger foundation for the society in general and its future development. In Armenia, advocacy efforts have helped 13.6% more women and 24.7% more children have access to government health services, leading to significantly decreased out-of-pocket healthcare expenses, which in turn has allowed families to access medical services without worrying about finances. As a result, we have seen a 145% increase in children under 1 taken to the hospital and a 25% increase in the number of children being born in rural clinics. Together, these interventions, along with others, contributed to a 10% decrease in the number of children dying before they reached the age of 5 in Armenia. In addition to advocacy work to address structural and institutional changes, World Vision also extends access to healthcare and provides sustainable solutions through the implementation of village health committees and the training of community health workers, both of which are on the front lines in the fight against childhood illness, malnutrition, and death. In Albania, thanks to local health committee members who trained mothers in the area of proper hygiene and nutrition, the number of malnourished children in World Vision's operating areas dropped from 5.2 to less than 1% in fewer than 2 years. In Bosnia and Herzegovina, less than 1% of disabled children go to school. Through student and parent councils, as well as advocacy and rehabilitation efforts, World Vision is working to make all schools in this country accessible to all children, regardless of their physical or cognitive abilities. In one school, students advocated and received approval for the installation of an elevator to allow their peers with mobility issues to be able to reach their classes. In Georgia, World Vision has worked with the government and other partners to not only improve the quality of educational environments through the rehabilitation of 47 educational facilities, but also the quality of education. As a result, more than 3 times as many families believe their children receive an improved education. And their impressions are validated by the fact that in 2014, 71% of children passed the test to enter higher education, compared to just 19% a few years earlier. In rural Romania, where 75% of the country's population who live in poverty reside, most school-age children return after class to empty houses. These children often lag behind their peers academically because they don't have anyone to support them in their studies. To address this issue, World Vision advocated for the government to provide after-school care. Today, nearly 100,000 children attend after-school programs where they receive help with their homework and nutritious meal at a safe place to be until their parents come home. In areas where World Vision operates in Jerusalem, the West Bank and the Gaza Strip, 42% of the patients treated by the United Nations Relief and Works Agency for Psychosocial Trauma are under the age of 9. To help support them and help all children in the area overcome the obstacles of growing up in a violent context, World Vision has established or rehabilitated 59 kindergartens and child-friendly spaces where they can learn and grow without fear. In Lebanon, World Vision has also supported youth to be able to advocate on issues that are important to them. Youth from across the country came together and lobbied at national and global levels for a number of issues, including the rights of children with no IDs and gender-based violence. In Pakistan, World Vision has helped families, women in particular, develop additional streams of income to supplement family needs, especially when traditional forms of revenue, such as agriculture, fail. 88% of women who participated in economic development training, where they learned trades such as embroidery, tailoring and candle making, are now successfully running their own businesses and are able to earn as much as $150 a month to help provide for the needs of their families. World Vision is striving to support 1.5 million families and children in Lebanon, Jordan and Syria who have been impacted by the violence in Syria with food, hygiene kits, heaters, blankets, as well as establishing water, sanitation and hygiene systems. World Vision is also providing for the intangible needs as we support children who have been traumatized through child-friendly spaces and seek to ensure that the future of Syria is not lost with the generation of uneducated children by helping refugee children get enrolled in school and supporting their education with accelerated learning programs to help them transition successfully into schools in Lebanon and Jordan. In a region characterized by political and religious diversity, where ideological differences too often result in children suffering, World Vision is working to bring people and groups with differing perspectives together and build their understanding of and tolerance for one another. In Kosovo, more than a decade after the war, the situation between ethnic Albanians and Serbs continues to be fragile, especially in northern Kosovo, where many communities are fractured along ethnic lines. Each year, World Vision's Kids for Peace Club brings together hundreds of children from both sides, helping them to dream of a common future and coming alongside to help them reach that goal. In Azerbaijan, World Vision trains social workers and equips parents to keep vulnerable children out of institutions, allowing them to grow up in the care and protection of their families. Development work is hard. As a global organization with more than 60 years of experience around the world, we know firsthand that oppression is everywhere, injustice is pervasive, and obstacles can seem insurmountable. But we also know that change is possible. We believe that child-focused, community-based, evidence-driven interventions are the blueprint to building a better world for children, helping them to overcome spiritual poverty, injustice, discrimination, conflict, social exclusion, and violence. We are always adapting our approaches and updating our strategies to cope with the constantly changing situations. Despite the difficulties we face daily, we are inspired by our Christian faith to continue ahead. We are not leaving. Will you join us?